All right, do you know your heart's age? Do you know it could be aging differently than the rest of you, according to a study done by doctors at the Northwestern University Feinberg School of Medicine? For many Americans, their hearts might be even a decade older than their actual age.
You don't want to hear that.
I
Sometimes
know.
your body feels a decade older
Yes.
when you get up in the morning. Heart disease is the leading cause of death in the U.S., but it can be really difficult to know your own personal risk. So that's why we bring in Dr. Payal Kohli, our 9 News medical expert, also cardiologist. So a heart age, I hadn't heard about that. And there's a lot of factors that you calculate in.
Yeah, so every day I struggle as to how to explain to my patients what their risk is. And the way that we used to do it as doctors, put all these factors into a calculator and say your chance of having a heart attack in the next 10 years is 7%, and over the next 30 years is 30%. Now that means nothing to most people.
Right.
They don't quite understand, is that high, is that low, what's the concept? So we're changing the paradigm of risk assessment. We're saying now we're going to look at your chronological age, how many years since you were born, compare that to your organ's age based on this calculator. So you can go online, calculate your own risk score, and Kim and Sam, I'm going to make you guys do this.
I know.
And a whole bunch of factors go in there. So your age, your sex, your blood pressure, your cholesterol, your blood sugar, your body mass index, which is your weight, whether you have diabetes, whether you have high blood pressure, even your zip code to suggest where you live, because we know that where you live can affect basically how your heart ages.
And then, okay, so you as a physician, what would you tell your patient? Why does this not only help them kind of like understand where their heart is, but does it also help you as well?
Very much, because you could be the picture of health, right? I'm looking at you,
Yep.
and you're in your 40s, and you're thin, and your blood pressure is probably normal, but then I can't assess factors like your family history. I can't necessarily assess other factors, that could be affecting where you're headed. And so for me as a physician, it doesn't just help the patient, but it helps me to know what sort of, what sort of medications to implement, whether additional screening is necessary. Do I need to do a heart scan on you a little bit sooner, because it identifies hidden risk when you look well on the outside, and it finds risk before it manifests itself. And then it's a kick in the butt for you, right? Because I'm not saying your score is
No, you're right
high,
though.
but if you're feeling good and you know you're going to get heart disease, statistically speaking, and you say, okay, well, my heart is 10 years older than my age.
That would scare me.
It's scary, exactly.
Yeah, because everybody knows somebody that's had a heart attack.
I mean, Hulk Hogan just passed from his heart attack, as we talked about last hour as well. And so I really do think every single person, regardless of their age from 30 onwards, because the calculator is only validated after the age of 30, should calculate their heart age on an iterative fashion. So as you get older and things keep changing, your risk factors, you want to keep calculating.
Because your body changes, medications change you. So what did the authors find in general about Americans and their hearts?
This was a wake-up call for me as a cardiologist. So we're seeing heart disease deaths go up, not down, even though we know what causes it. And what they found is out of 14,000 sort of representative Americans, both men and women actually had heart ages that were older than their chronological age. So women by about 4 years and men by about 7 years.
7 years, almost a decade.
7 years older than their chronological age, and that's the average person. And if you start to dive into some of the people of color, you can see black men 8.5 years older than their chronological age. If you don't have a high school education, a third of you are 10 years older than your chronological age.
Jeez.
So you're talking about most Americans, the average American, missing the boat here.
And why is that? Is it our diet? Is it our lack of education when it comes to heart health? What would you say?
Yes, yes, and yes.
Okay.
All of those factors.
Yeah.
In fact, we're even identifying air pollution, which we haven't really recognized as a cardiovascular risk factor. It's not even in this calculator, as another modifiable risk factor as well. But what's really interesting, if you look at all the things that go into the calculator, the only things that are not modifiable, your age, your sex, and your family history. All the other factors in your control. And so to me, the fact that we're so far behind, there's so many things that we can work on. To me, this is a wake-up call for every American to say, I'm going to make sure that we beat heart disease collectively as a community by getting ahead of our risk. So it's never too young to calculate your heart age and to go talk to your doctor about your heart age and say, what can I do to change this? And if you go to the American Heart Association's website, they have Life's Essential 8. These are the 8 things you can do to to reduce your risk of having a heart attack or stroke. So you guys didn't calculate your age, but I did.
heard yours is, tell us.
Yours is good.
7 years below.
Yay, Dr. Coley.
So I feel good, but there's still work to be done.
Okay.
So even
All right.
if your heart age is below your chronological age, which is what we shoot for, or at least the same, you start to worry when it's more than 2 or 3 years above. There's always something you could do better. So for me, it's sleep. I think those 7 to 9 hours a night, stress reduction, and then probably a little more exercise.
Oh, okay, Dr. Coley.
Yeah,
Good
I
job.
doubt it. She's a good
I
doobie.
know.
But we'll all look at this, go online, find it, do it. It's simple.
It took me less than 2 minutes, and you just need your last kidney function, your last cholesterol, your height, your weight, and that's it.
That's
Perfect.
it?
Yeah.
Okay. Well, we'll do it. Thank you.
Thank you.